Okay, hello. First, I'm gonna start by washing my hands. Hello, Miss Hope. I'm Marquette Collins. I'm a registered nurse, and I'll be taking care of you today. I'll be performing a full head-to-toe assessment. It'll take between maybe 15 to 20 minutes. And please feel free to ask me any questions during this assessment. I want you to know that your privacy and confidentiality are completely respected throughout this whole process. Okay, so first part of this assessment, I'll start by assessing your mental status. My patient appears alert and oriented. Could you tell me your name, where you are, and what today's date is?
Tamara Holt. I'm at the hospital and it's October 5th.
Thank you. Her speech is clear. Her facial expression is appropriate, and her mood appears calm. Now I'll test your memory. Please remember these 4 words, and I'm gonna ask you them again a little later on. The words are apple, car, house, and ball. Got them? You need to repeat them? Okay. I asked you to recall those later on. So for recent memory, can you tell me what you had for dinner last night?
Meatloaf.
Okay. And for remote memory, can you tell me the name of your first school?
Easton.
Okay. So could you repeat those words for me now?
Ball, house, apple, car.
Okay. So my mental status is complete. My patient appears alert and oriented. So now I'll move on to my vital sign assessment. I've already taken my patient's vitals, and her temperature is 98.6 Fahrenheit. Her pulse is 72 beats per minute. That's regular. Her blood pressure is 120/84. Her respiratory rate is 16 breaths per minute. And her oxygen saturation is 98%. So all of these values are within normal limits. And now I will assess her pain. So on a scale, Ms. Holt, from 0 to 10, with 0 being no pain at all and 10 being the worst, how would you rate your pain today?
0.
Okay, so my vital sign and pain assessment is now complete. Next, I'm going to assess your skin. So I'm gonna look my patient over. She has on pants. I'm gonna pull those up so I can make sure that her skin tone and her color is uniform and even throughout with no lesions or anything. So my patient's skin is uniform in color. I don't see any lesions. I don't see any tattoos. I'm gonna assess her skin turgor by pinching the back of her hand. And her skin turgor seems normal and appropriate, and that means that my patient is well hydrated. So I'm gonna palpate her skin for moisture, texture. I'll check for any lumps or tenderness during my assessment. So I'm gonna shake those arms again, legs and feet. And everything seems normal, no tenderness, no lesions or pain. Everything feels normal. I also compare the temperature of your skin, and I'll use the back of my hand to do so on both sides. Her skin feels warm and equal in temperature on both sides. So now I will move on to my face and head assessment. So I'm gonna inspect your head, Ms. Holt. Her skull is normocephalic, meaning that it is of normal shape and size. Her scalp is free of lesions or abnormalities, and her hair is evenly distributed. She has coarse hair and it's black with some sandy brown highlights. So now I am going to inspect her face. Her skin color is even. My patient has no lesions. Her facial features are symmetrical on both sides. I'll test my patient's cranial nerve by lightly touching different areas of her face. So I'm gonna touch different areas of your face, and I want you to tell me where I'm touching.
My forehead, my cheeks, my chin.
Okay, great. Now I'm gonna have you clench your teeth while I palpate your masseter and your temporal muscles. Both muscles are strong, they're equal bilaterally, and I'll also test her cranial nerve or her facial nerve by asking her to smile, frown, and I want you to resist me opening your eyes. Okay. So I don't observe any facial drooping, and that concludes my head and face assessment. So now I am going to assess my patient's nail and capillary refill. So I'm inspecting her nails. They are convex, trimmed, translucent. I'm not seeing any clubbing, and I'm going to check your capillary refill by pressing on your fingernail. And your cap refill is within less than 3 seconds on, let me check the other side. It's less than 3 seconds on both sides, so that's normal. Now I'm gonna move on to inspecting my patient's eyes and vision. So, grab my pen light. I'm inspecting her eyes. I see no drainage. Her eyelashes are everted with they are evenly distributed. Her eyebrows are symmetrical. And I'll test her optic nerve by using the Snellen chart over here to our right. So I'm gonna have you, Miss Tamara, cover one eye, and I want you to read that small line down there.
A, B, C, D, E, F, G.
Now I'm gonna have you cover your other eye.
A, B, C, D, E, F, G.
Now I want you to leave both eyes uncovered and read again.
A, B, C, D, E, F, G.
So my patient's vision is 20/20, and I will check her for eyeglasses. But if she doesn't wear eyeglasses, if she did have eyeglasses, she will remove them for the color discrimination part of the eye assessment. So now I'm going to check her extraocular movements by following with my finger without turning your head. Okay. I'm testing her ocular motor, her trochlear, and abducens. So her eye movements are full, intact, and there's no nystagmus present. So now I'll inspect your pupils. I'm gonna use my pen light again. So her pupils are equal in size, round, they respond to light and accommodation. I'm gonna dim the light, and I'm going to check pupil reactions. So both pupils, they're constricting equally when I shine the light, and the opposite pupil is also constricting. So this is called consensual response. And her eyes are Perla, which is pupil, Miss Tamara, pupils equal, round, reactive, light, and accommodation. Can I call you Miss Tamara? Okay, Miss Tamara, now I'm going to use my pen light, and I'm gonna look in your ears. So right now, I am inspecting my patient's outer ear canal for any foreign bodies. I'm going to this side. Okay, I see a small amount of cerumen in your ears. I'm going to have you hold your hand over one ear, occlude an ear, and I'm going to whisper a 2-syllable word in the other ear while covering my mouth. And I want you to tell me the word I say. But I'm not going to let you view my lips.
Pizza.
Okay. And I'm going to do it to the other side, but I'm going to say a different word.
Pepperoni.
Okay. So this lets me know that her vestibulocochlear nerve is intact, and this is evidenced by her ability to hear the whisper word bilaterally. My patient's ears are symmetrical, on both sides. The tip of her ear is at the same level as the palpable fissures. Her skin is uniform. She has 3 piercings bilaterally. There's no drainage, no tenderness on her, over her auricle tragus or her mastoid process. If I was assessing my patient with an otoscope, I would assess the color in her ears. I would assess for any lesions or abnormalities. I would be assessing for wax or ceruming. I would be looking for foreign bodies, discharge. I would also be visualizing her tympanic membrane for its positioning, redness, discharge, any perforation, position, and so that ends my ear assessment on this patient. So now I'm gonna move to her nose. I'm gonna inspect her nose, which is midline, as we can see, without any deviation. I'm gonna palpate her frontal and maxillary sinuses. So your frontal will be above the eyes and below the cheekbones. Do you feel any tenderness? Okay, now I'm gonna check for nasal patency. I'm gonna have you occlude one nostril and you're gonna sniff through the other. Now switch sides. So, okay, everything normal with that. So now, I will test the cranial nerve by holding this scent under your nose. Can you smell that? Can you smell it? Okay, cover one nostril. Can you smell it through that nostril? Okay, and do the other side. Can you smell it? Okay, so, great. We're done with that part. So now I'm gonna move to her mouth and her throat. Okay, Miss Tamara, I'm gonna inspect your mouth and throat. Your lips are symmetrical. They're pink, moist, free of cracks. I don't see any lesions. I'm gonna use my pen light and inspect her buccal mucosa. Okay, so it is pink throughout, smooth, and moist with no lesions. All my patient's teeth are present, so that checks out normal and in good repair. So her gingiva is pink. I don't see any swelling or bleeding. And I checked her hard and soft palate. They are continuous and smooth without lesions. My patient's uvula is midline and it rises symmetrically. Could you say ah for me? Okay, so that checks out normal. So this indicates that her glossopharyngeal nerve, her vagus nerve, are both intact. So lastly, Ms. Tamara, I'm gonna check your tongue. Maybe stick it out for me. Her tongue is pink, moist, and has the regular texture. When you stick out your tongue, stick it out one more time. I'm checking to see that it protrudes in the midline, and so her hypoglossal nerve is intact. Okay, that concludes my mouth and throat assessment. We'll move on to the next one. So next, Ms. Tamara, I'm gonna move to your neck. I'm gonna move over a little bit and look at your neck. Okay, so her skin color is uniform with the rest of her body, and her neck is symmetrical. So I'm going to have you look both ways. Okay, she has full range of motion. I don't feel any crepitus. I'm gonna test the strength to Miss Tamara of your trapezius. So I'm gonna in your sternocleidomastoid muscles, and I'm going to have you shrug your shoulders while I touch and turn your head against the resistance. So shrug your shoulders. Okay, you can drop them down for me. Try to turn your head against my, okay. So her strength is equal bilaterally, including her spinal accessory nerve, which is intact. So I'm gonna palpate her lymph nodes. I am checking the occipital at the base of my patient's skull and her preocular in front of the ear. Her post-auricular, will be me touching behind her ear. So I'll touch her, test her submandibular, and that's below her jawline. I'm gonna feel under your chin. That's your submental. Your cervical lymph node, which I touch down the sides of your neck. None are palpable, and that's completely normal, Miss Tamara. I'm gonna palpate your carotid arteries, which I just did, and then listen with the bill of my stethoscope. So I'm gonna have you hold your breath. Let me grab really quick. Okay. So I felt your carotid artery when I felt over here. I'm gonna check it again. I'm gonna check one on the other side. I'm sorry. And then I'm gonna have you hold your breath and I'm gonna listen with the stethoscope. So her carotid pulses are strong and they're equal bilaterally. I don't hear any bruits at all. Now I'm going to assess my patient's spine. You're just gonna sit straight up like that. So her spine is midline. It's S-shaped at a lateral view. I'm going to palpate her for any lumps. You feel any pain? No abnormalities that I'm feeling, no firmness present. I'm gonna palpate, I'm gonna have you breathe in deep, in and out, and I'm gonna palpate your chest expansion, okay? So now I'm going to listen to you, Ms. Tamara. I'm gonna listen to you posteriorly, anterior, and I'm gonna listen to your lateral, your sides. And this will be in 10 areas, okay? And you actually can turn for me. Turn that way. So I'm gonna listen to you in 10 areas back here. And just breathe regular. Okay. Take a deep breath for me. Let me have you take a deep breath through your mouth and breathe out. So my patient's vestibular sounds are present in peripheral lung field so far. I'm gonna listen to her. Okay, so her lung sounds are clear bilaterally, and I don't hear any adventitious sounds at all. Okay, Miss Tamar. So, I am going to now teach you. You can turn back forward for me. I'm going to teach you how to do a breast self-examination when you're at home. So, when you're at home, you could be laying down, you could be in the shower, but you should always inspect your breasts for symmetry. They won't be the exact same size, but if you notice a huge difference, always contact your healthcare provider. You should inspect your breasts for any skin changes, nipple discharge, and you can do this in 3 different positions. So you can have your arms at your sides, raised, or your hands pressed on your hips. While in the shower, lying down, you can use the pads of your fingers and palpate your breast in a circular motion, moving from the outer part in towards the nipple. You're gonna check for any lumps or masses, and if you notice any changes, please contact your healthcare provider, or any huge difference or something's off. So you're gonna palpate your axillary lymph nodes, your lateral, central, posterior, and anterior axillary nodes. You can squeeze your nipples to check for discharge, and you shouldn't be able to palpate these lymph nodes or have any masses, dents, striated areas, or anything like that. Your nipples should be darker and either inverted or everted. So, and your color should be continuous with your breast. And if you notice any changes, please contact your healthcare provider, or any huge difference or something's off. That will conclude our assessment. Everything looks good today, Ms. Holt. Do you have any questions for me?
No, ma'am.
Thank you for your time.